Welcome back to Houston Life. Turning now once again to your health. Back pain can be unbearable. A lot of our viewers are raising their hands right now. So whether you have it, your family member, or a coworker, most people think the solution is just to ignore it. That's one option. See a chiropractor. That's the second one. 3, undergo a serious surgery. But today we're introducing you to a new treatment option for back pain. This option is available right here in Houston. Joining us now is Dr. Ankur Khosla with AK Pain and Spine Center. Welcome, Dr. Khosla. It's good to meet you.
Yeah, likewise, appreciate your time.
Well, you got some props here. We're going to get to those in just a moment, but I feel like the stats speak for themselves. 8 out of 10 Americans will experience back pain, sometimes at debilitating levels in their lifetimes.
Yep. So it's the #1 reason for people to present to their primary care doctor for a pain source. As we know, we've got an aging population, and it's the #1 reason for surgery in our patients who are 55 and plus. So absolutely, it's very common.
It's the #1 reason people go to see their primary care physician. That I had no idea. Let's talk about your practice. So what makes it different?
So at the end of the day, my job is to figure out where that pain source is coming from, and then we can offer a slight interventional therapy using high technology to be able to turn those pain sources off.
Okay, so people don't need to be freaked out about going into like a major surgery scenario, because I've dealt with back issues. I've thrown my back out a number of times, which has kept me away from normal activities for a couple weeks. Talk about your process and bring in these props here. What do you have?
Yeah, so when we evaluate a patient, of course, we want to make sure they've tried some of the conservative care options. Have you tried physical therapy? Have you tried chiropractic care and those other over-the-counter medications, right? And if those fail to provide relief, we can use advanced imaging like MRI or X-ray to be able to identify directly where the disc might have degenerated, where the joints might be pinching, or that nerve root is feeling a pain source.
Okay, and can you show us what we're looking at
Yeah,
here? So those are nerves.
So what we have here is a model of the spine. These are the bones, these are the discs, and these are the nerves. As these discs degenerate, it can put a lot of pressure on those nerves. So if you ever see somebody at the grocery store that's leaning forward on the shopping cart, what they're doing is they're trying to relieve the pressure off the backside of that nerve.
So as the discs wear down, the increased likelihood of a pinched nerve happening is presenting itself.
You hit the nerve on the head.
Okay, there you go. I like what you did there.
Yeah.
You actually travel around and you teach other doctors how to do this. So clearly there's a great need for this type of methodology.
So the nice thing about being in this position is we get to partner with some of the new technologies that are available to us. So I can have a training course all over the country to teach different physicians how to offer these options for their patients as well.
And what have you found? I mean, clearly it's working, right? I mean, for patients, what are they coming to you saying? What are the results?
Yeah, so most patients are coming to us saying, Doc, I can't stand for prolonged periods of time. Meal prep is kind of difficult for me. My back will tap out at about 8 minutes. Or even walking down the driveway could be painful. So for those patients that are having that difficulty standing, walking long distances, we can offer these therapies. If they require a small outpatient procedure, it's about a 1-week recovery, 20-minute procedure, and then they're back to doing the things they love.
You get your life back.
Yeah.
Can you talk a little bit more about your therapies and what it is you do?
Yeah, so specific to this indication, if you've been told you need back surgery, or you're having that sciatica, or the symptoms of disc degeneration,
which is very common.
What we do is we just kind of measure the distance back here that your spine would normally flex out into and place a little brace there. What that does is it stops that backside of the nerve from compressing. Leg pain goes away right away. It takes maybe a couple days for the back pain to follow, but then patients are back out there playing golf again.
Okay, well, that's incredible. Dr. Ankur Khosla, next time you're going to join us, because I want to know a little bit more about your backstory and how you got into this field. So we're going to continue taking a closer look at these treatment methods, plus we're going to hear more about some of your success stories.
Awesome.
Thanks so much for stopping by Houston Life. Yeah, good to meet you. We will see you next time. And in the meantime, please give AK Pain and Spine Center a call, 281-896-0013. The first 25 callers will receive a free screening. You do not need to be seen today, just call today. The website is akpainandspine.com. And of course, tell them Houston Life sent you. We'll be right back.